Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from my Team Needham podcast studio. And I am super excited to have Dr. Greg Schneider on our podcast. I met him at Dr. Jack Wolfson's office, natural heart doctor, down in Scottsdale a few months ago, back in November, and had a great chat with him and we just talked about how chiropractors can help people get back to their daily lives. And we were just chatting before the show on how important, when I think of health, that's really what I think of, why we want to why we want to eat right, why we want to sleep right, why we want to do the right kind of movements, the right kind of exercise, and see the right kind of healthcare practitioners because of our daily lives. We want to be able to function in our daily lives. I mean, you think about the breakdown of people when they get sick, it's really, they start having a hard time getting up, out of bed even. They have a hard time walking. Those are daily functions that we want to be able to do to stay healthy the rest of our life. So chiropractor can actually help us get back to function and keep us in function. So Greg, welcome to our show.
Thanks for having me, Shawn. Glad to be here.
Tell us a little bit about your history of how you kind of were first introduced to chiropractic work.
Yeah. So, well, I guess I kind of have to start a little farther back, but growing up, I was very involved in athletics. It was important for my father to push kind of me and my brothers to pursue, athletics into some extent growing up. And I found that, I kind of had a passion for it myself through adolescence. And after college, I started kind of out as a personal trainer. And I was kind of doing a bunch of different things at the time, running 5Ks, just being generally athletic. And I had gotten involved in CrossFit. And that was a big passion for me. That was kind of a life-changing thing. As I did have a passion for athletics, that was kind of my first experience of being involved in a community of like-minded people who were health-focused and personally excellence-focused, kind of pushing themselves and just trying to see what their potential could be in any particular way. But I met a chiropractor through my gym there. And up until that point, I hadn't really been exposed much to chiropractic or rehabilitation exercise or anything like that. I heard of them. I kind of knew what they do, but I didn't really understand what the benefits might be. But I had this essentially this neck pain where I couldn't really turn my head all the way to the right, and I had this kind of numbness and tingling going down into my fingers. So I went to see this guy, and, I had my first adjustment when I was 25 years old. So for some people, I was a little behind the ball. I know there are patients I see all the time who've been adjusted from birth, which is great. Mm-hmm. But it was kind of, again, it was life-changing. And the fact that, I had been dealing with this kind of lack of motion and this kind of operating at, maybe 70% of what I was capable of. For longer than I knew. I didn't even know what I didn't know in terms of, what was wrong with me, so to speak. But he adjusted me. I felt an immediate difference. And then in conjunction with that, he gave me a kind of a battery of corrective exercises to help focus on strengthening my hips and my back, as well as kind of the function of my shoulders in order to kind of make sure that long-term, I was set up for success and I would able to continue to do the things that I love to do kind of going forward. And it was pretty much, after that, being a personal trainer at the time, I got hooked onto it. And I think within 6 months, I had applied to Logan University, which is where I ended up graduating in 2021.
Oh, wow. I mean, that's pretty compelling from not really knowing much about chiropractic to 6 months going to chiropractic school. That's
yeah. It was, like I said, the combination of the adjustments with the consistently doing the exercises. I mean, it was pretty incredible, the difference I could just feel, not just my level of overall soreness or pain, but just my ability to kind of move better. And again, my, being someone who was trying to realize my potential physically, the difference was there for sure.
Well, I think that's one thing that a lot of people don't know about chiropractors, and I'm glad you're educating us about that today, is that a lot of times they think it's just adjustments. That's all chiropractors do, is just adjustments. But I've been to multiple chiropractors, and one of the best things I think they do is educate us on, like you say, certain exercise and movements to do at home between adjustments, so we can stay functioning in our daily lives and stay competing at whatever sport or whatever athletics or whatever activity we want to do. And that's the important thing. That's why we're talking about function, so we can just function in our daily lives. So I want to share a story about an injury I had as a chiropractor and how I think about it, because I'm thinking about your story too. I'm thinking about what would have happened if you would have went to a traditional doctor with your neck pain. And we know, and as a pharmacist, we know probably what would happen is they would give you some anti-inflammatories, maybe some muscle relaxants, and send you on your way. And then, not really fix the problem. I mean, we're just masking the symptom, right?
Right. Yep.
And I had something that happened like that. It would have been about 5 years ago. And I had some back pain, and I thought it was kidney pain, like flank pain, kidney pain, related. And so and it's kind of funny, Greg, and you know this from talking to my wife and I, but we're two pharmacists that believe in very conservative treatment when it comes to drugs. And for long-term disease, we just don't believe in drugs for long-term disease. So anyway, one of my friends, obviously we're in the medical profession, so we're around people all the time that can prescribe drugs. Yeah. And they're like, well, I can prescribe you some anti-inflammatories and some muscle relaxants. I'm like, no, I don't really want to do that. I want my problem fixed. Anyway, I hadn't been to my chiropractor in like a year. I just putting it off, and anyway, went to the chiropractor, and they did some adjustments and some mild massage, and I mean, my back pain was better. I mean, almost immediately. And I thought, how many people over the years have I given medications to for back pain for years that all they needed was some chiropractic work? Yeah. And the side effects from the drugs, unreal. I mean, we had a chiropractor on our show before, and one of the things that he mentioned, and I didn't realize this until he mentioned it, is that one of the advantages a chiropractor has, not a disadvantage, but an advantage a chiropractor has, is a chiropractor can't prescribe drugs. That's an advantage. You guys 100%. Have to find ways to fix things, not just treat symptoms with drugs, right?
Right. Yeah, exactly. So you have to come up with, you can't rely on this I don't know, what do you, duct tape approach, where you're just kind of throwing it and it's just like, you're going to feel better, where you're just treating the symptoms. It's like, well, the symptoms are a response to the source of the issue. And I can't just, if I'm going to get rid of your symptoms, I have no choice but to focus on treating the source of whatever it is that's going on with you. Because I don't have like you said, the pharmaceutical duct tape to handle those symptoms and just, give you the magic, what have you. So,
Right. So, tell us a story about how, recently, if you can remember, somebody that you've treated that, was just a very, very rewarding case. They had some kind of pain or function problem, and you treated them and had success. Tell us the story about that.
Yeah, so I had a patient in actually just a couple of weeks ago who he was a little older. He was in his 40s. I did meet him through my...
wait a minute, Greg. A little older? Come on.
A little
in his 40s.
A little older than me, I guess. A little older than me, being 32. I know I misspoke there. He's super young. He's young, super young, not old, but he was having some trouble with his shoulders. Specifically, anytime he would work out, he would have an issue pressing overhead. So, and I believe that, there is no such thing as a bad movement or a good movement. I think that's something that, I feel I need to touch on. There's only movements that our bodies are prepared for or not prepared for.
Yeah, good point. Right.
So there's nothing wrong with the overhead press. Now, that being said, while I was treating him, we did step away from it for a minute. But the goal ultimately was to get him back to being able to press overhead again. Right. So if anybody, I never want to be, or don't think it's, the right thing to say to anybody, well, just avoid, just don't do that anymore.
Right.
Yeah. That is never the answer.
I love that. Sorry to interrupt you. Please keep your train of thought.
Yeah.
I love that because as I'm a competitive mountain bike rider.
Yes.
And if I went to a doctor and they told me, well, you're just going to have to quit riding your bike. No, that's not the answer. That's not why I came here. I don't want to stop riding my bike. My bike is part of my life, part of my function. I want to keep riding my bike. So I love that. Yeah. Perfect. Okay. So go on to the story.
Yeah. So he came in, he had, like I said, he was pressing overhead, mainly really had problems coming down and what we call kind of the eccentric phase of the movement. So when you kind of go up, that would be called the concentric phase. Coming down would be the eccentric phase. And so I noticed that, his mid-back extension, like many people, was not great. He also had some neck pain as well. And the body is intimately related and connected in terms of how it moves. So just because you have pain in your shoulder doesn't mean it's not ultimately the consequence of other stuff not moving well, right? So your shoulder may be more stressed simply because your mid back is not in a position to where it can handle stress as well, right? So we adjusted him regularly. We did some soft tissue work to kind of help with the pliability of the muscles around the areas that weren't allowing the motion as much. And then we did some isometrics and some strengthening exercises for the shoulder itself. And I would say in about a couple of weeks, we're still working together. We're doing the exercises again to set him up for long-term success so that, again, these areas are moving better. And, that's not always a super quick fix, but we were able to bring down his pain to a tolerable level to where he is now able to press again without pain in about 2 or 3 weeks.
Wow.
So now when I say that he's not, setting PRs just yet. We're trying to take it a little slower to make sure, again, that long-term he's moving in a way that's conducive to his success. But we are definitely kind of moving in the right direction there.
I love that. I love that. So we do have a comment from one of our viewers. Yeah. I'd like you to answer it. So Linda Roth Harless, she is thank you for listening and watching, Linda, your loyal viewer. There are times you should tell a patient not to do certain exercises that'll hurt them. There are moves the body should not do. Can you comment on that, Greg?
Yeah. So I understand that is kind of a perspective, but when it comes to, soft tissues, the bones, muscles, tendons, ligaments, it's all about the, as I said, the management of load or what the body is or is not prepared for. So for instance, it is a big, for instance, CrossFit. I do CrossFit. A lot of people, CrossFit, it injures you. You get injured. And that does happen to people in CrossFit. And what I would say is in that situation or any other situation is you're doing more than what you can handle before your body's ready for it, right? So if you, let's say you want to do pull-ups and you start to injure your shoulder because you're doing the kipping stuff, right? Well, that kipping is putting an extreme amount of load on your biceps tendon that if you haven't worked up the tolerance to that load yet by doing, traditional pull-ups or other exercises to strengthen those tendons and ligaments, then you're going to set yourself up for failure, or you're going to set yourself up for injury. So again, the body responds to, to load, volume, intensity, and movement in a way that is kind of dose dependent. So it's just like anything else. You have to kind of start small and work up to it in order to kind of be healthy and build that tolerance to it. But I don't believe that there is any particular movement that is necessarily bad for you in, under certain conditions, for sure.
Yeah, no, that's a great educational point there. I really appreciate that you went into that in depth. And I was actually going to mention the CrossFit thing. I have a chiropractor friend who's very healthy. That's what I love about chiropractors is most of you guys are very healthy yourselves. And he mentioned that, CrossFit is some of his best business. Yeah. And so you being a CrossFitter, I was going to ask you about what you think about that, but you just answered the question. Because, you see, some of the best videos you can watch on CrossFit are, YouTube CrossFit fails.
Yeah.
And the snatches, some of the snatches are some of the best ones.
Yeah.
But they get injured, and it's basically what you're saying is they're overdoing it. They're not prepared to do that much weight or that much volume or that quickly
at that intensity. Yep.
Yeah.
Under fatigue before they've properly learned how to do the movement correctly. And sometimes even it's not even, or that's one part of it. But the other part is as we talked about, earlier when I was mentioning my patient case, is if their body is not able to synergistically function the way it needs to. For instance, if I don't, we talked about snatch, if I don't have the ability to extend through my mid back well, and I can't get in the position to hold a snatch in the right way. And what that's going to do is it's going to put additional stress on areas that shouldn't be stressed in that particular way.
Yeah.
So it is a combination of not just load tolerance, but also making sure that the body is first functioning in the way that it's able to tolerate those movements.
Yeah. And I'll tell you, snatch is one of the best, most explosive overall exercises, complete full body workout. But I can tell you right now, if I tried to go and do as many snatches that I could with, fairly moderate to heavy weight right now, I guarantee you I would get hurt.
Oh yeah.
But you can also work up to it. And that is a comment we can bring up from her. I disagree with the saying no pain, no gain. And I do too. I mean, when we exercise, it's going to hurt, but we got to know what kind of hurt that is.
Exactly.
If it's hurt that's going to bring injury, then absolutely, our body does send us signals to pain signals to know when we're overdoing it. Can you comment on that?
Yeah, I do agree that the no pain, no gain approach is that is not something I would ever tell anyone. There is a difference between soreness and muscle fatigue or lactic buildup and true pain. If it takes some, I think, experience to kind of understand the difference. But I mean, if you're getting sharp shooting pains somewhere while you're performing an exercise, that is a no-go. That is a red light. Do not do that exercise. Again, we go back, we address, well, why is that happening? What is it that you're doing? Are you moving too much too quickly? Is there something going wrong with function? But that is definitely a red light of let's take a step back. Let's kind of look at what's going on, and let's kind of, maybe go a little bit lighter or modify the movement somehow.
Absolutely. What are your thoughts about, Linda also mentioned about people that aren't stretching before exercise. What are your thoughts about about stretching? There's arguments on both sides. I don't think I do enough of it. My coach does prescribe it, but I don't do enough of it.
We could all do it a little bit more. I'm guilty of it.
It's one of those things. It's like you don't feel that you're getting a lot of benefit from it, So you
in the
just like,
moment.
you just push it away, right? So
Yeah.
tell us what your thoughts are about stretching or warm-ups.
Warm-ups so here's the thing. I've been trying to get better at it. I've been the guy, granted, because I'm passionate about it, but I was the guy in the corner that would warm up for 45 minutes before I'd even start my workout. So I'm a little biased, I think. But as far as stretching goes, I do think it is beneficial. It is beneficial, especially after an exercise or after a workout. There is kind of a debate on, or not a debate, but a difference between what is considered pliability and mobility. So people kind of get these terms a little confused. So pliability would be static stretching, and mobility would be your ability to essentially actively achieve a position. So you're consciously contracting a muscle as you're kind of going. So you're not just basically, holding your leg over your head. Whereas like if you tried to actually pull your leg over your head, maybe you get about 50% of the way there, right? But stretching is great after a workout. It does help with preserving function and the pliability of tissues, which is important. But ultimately, what is kind of neglected is the act of mobility, the ability to actively move a joint or a limb into a position that it needs to go into. So stretching generally won't kind of help with that. But it is kind of an important component of it, if that makes sense.
Yeah, it does. I like the term you're using. It's a common term, but I like the context you're using in the mobility.
Yeah.
And when you think about what we're trying to do with warm-ups or cool downs, it's really mobility. I mean, I think about my warm-ups and my cool downs on a bike. And, after a really intense ride or really intense race, the last thing you want to do is stop pedaling your bike and get off, because you're going to, you're not going to be very mobile.
No,
your hamstrings,
you're walking like a 10-man.
Right. Your
Yeah.
hamstrings and your glutes are going to be completely blown up.
Yeah.
And so I like how you put mobile in there.
Yeah.
So as a chiropractor, what kind of age groups you mentioned, babies, but what kind of age groups you take care of when it comes to chiropractic work?
So chiropractic work, we believe that everybody should be, adjusted, right? So obviously it's going to look different. I'm not going to adjust, an infant or a toddler the same way I would adjust a full-grown adult. What I may do is just apply some pressure points, assess, the alignment of the spine. Just make sure everything is kind of where it should be, how it should be moving. But I adjust plenty of people's kids. I adjust men and women that are in their 70s, 80s. I even think I treated a 90-year-old the other day. Again, everybody's spine is going to be a little different. As we age, it might be the mobility of the spine might be a little different, but the benefits of an adjustment is it's there for everybody.
I love that. So tell us some. When we think of, we talked about it. I think because of your background being a personal trainer and being, having a CrossFit background and stuff, you obviously are going to treat a lot of athletes, or weekend warrior type people. What about common day-to-day stuff, and maybe even common day-to-day disease states that chiropractors can help with, in work our way back to optimal health? Mention some of those things.
Yeah. So I primarily, there are many different chiropractors who kind of practice different ways. I hear I'm on the natural heart doctor team. And so I focus on my area of dealing with kind of chronic musculoskeletal pain, function, regardless of what, athletes or everyday people. Right. I will, people come into me with low back pain and they are, blue collar workers, or they are just somebody who isn't an athlete. They just, maybe they work out 3 times a week and they just have, back pain. And, everybody is, and I know we're focusing on general population, but I truly believe that everybody is an athletic body.
I agree with you 100%. We were created to be athletes.
Yeah.
And so we should all train like athletes. We should all eat like athletes. We should all sleep like athletes. Perfect. I love that. Great. Go ahead.
So everybody is an athletic body to varying degrees, right? We're not all professional athletes, but everybody is made to move and made to strain and in many different ways. So just because, I might treat, a collegiate athlete, it's, they are, people see them as something entirely different than, the middle-aged woman with 2 or 3 kids. And to some extent, maybe the degree of, what their activities are, is different, but ultimately I look at them the same way, because a body is a body. Yeah. So, if, this woman comes in with low back pain, well, I'm still going to look, are her hips stable? Are the joints moving well? Is the pelvis and the joints of the low back, are they synergistically moving in a way that's conducive to long-term stability or function? I'm going to approach both of these people in the same way, in order to just maximize their ability to move the way that they need to, in their own individual lives, whether that's scoring touchdowns on the football field or just being able to kind of, go shopping, do their job, take care of their kids, whatever it is. So.
Yeah, I love that. And I use that analogy often, is that, treat our bodies like an athlete, because when you look at it ancestrally speaking, centuries and centuries ago, we were made to run after animals and kill them, and so we had to run. We had to be strong to however we killed it, whether it be through a spear at it or tackled it or whatever we had to do. And then we had to carry it. So we had to be strong there. And, and then the eating portion, we ate good, raw, whole foods.
Whole foods. Yeah.
Yeah. And we had to work to get our food, whether it be pick berries or pick fruits or pick vegetables or go run after an animal. It wasn't in our pantry and our refrigerator at our disposal all the time, which also brings me up to fasting. There were times we had to fast because we didn't have food.
Yeah. And our bodies were made for that. And Absolutely. That's why this, intermittent fasting, multi-day fasting, we're talking about all the, killing the zombie cells and all that stuff. And it's like, well, yeah, our bodies were made to exist for a period of time without food. And it's interesting. We talk about, the movement and stuff, because it's, anthropologically speaking, we are nomadic creatures.
Yes.
So when we say that, everybody's an athletic body, that's true, because we, as you mentioned, we were made as creatures to move. That is our primary function, to move from place to place. We are hunters and gatherers.
Yep.
That is how we evolved, and that is how our body functions and responds to different things. So,
and when you mentioned that about the fasting one, our body was designed to fast. Well, why do you think we're so good at storing fat? And unfortunately, right? I mean, because we were designed to not be able to eat for days.
Yeah. And now we exist.
With all the food we have now and an overabundance of it, we just store too much fat as Americans mostly.
Yes. Yeah. And exactly. So we're in this environment where, caloric scarcity is not a thing, where we have access to all these things that, sugar and low abundances was, it was almost a delicacy back in the Paleolithic. These things that were, there's a reason why we're programmed to, crave these certain things in certain quantities, because they provided a necessary part of our diet, energy. But now that we have an abundance of these things, refined sugars, all this stuff, it's become a problem. It's become a problem, and a problem of too much accessibility.
Yeah,
right.
Absolutely. I mean, I tell people one of the problems in America is that in general, we basically have an unlimited food source.
Yes.
I mean, just by going home in our pantries and our refrigerators, we have almost an unlimited food source. And if it's not unlimited there, we have access to it other places, that we can get it at the grocery store or wherever we can get that, whether it be at McDonald's or wherever we can get that food. We have unlimited access to it. And that's a problem.
Yeah. And I mean, you have these, in the last couple of years, and I'm sure they, over, the quarantine, a couple of years ago was probably even worse, but the apps, the Uber Eats, the DoorDashes, now you don't even have to leave your house.
No,
you can get these things. Somebody else will bring it to you.
Right. Yeah. You don't even have to move to get your food now.
Literally.
I mean, literally. And how bad is that? Totally opposite of what we were talking about that we did centuries ago.
Yeah.
I mean, that is just, that's a real problem,
Yeah.
And you don't have to cook your food either. That's a problem too. You don't have to prepare it. So, man, this has been a great conversation. We're going to have to stay in touch, and I'd like to have you on, talk about some other subjects too. We could go on and on with all these tangents. I love it. We're on the same page. I really love it. So, as we wrap this podcast up, what do you have a passion for?
What do I have a passion for? I have a passion for, we've kind of hit the nail on the head here a few times, but I have a passion for movement. I have a passion for, again, helping people be lifelong athletes, explore their physical potential, whether they're 14, 44, 64, 84, what have you. Everybody always, you can always make progress in a particular area. And I think in order to live a high quality, happy, healthy life, movement needs to be a part of your lifestyle.
I love that. Gosh, I love that. So if anybody has any questions, what's the best way to get a hold of you?
The best way to get a hold of me would probably be through Instagram, which would be at dr.greg.schneider. That would probably be the best.
Awesome. I love it. So thank you so much for being on our podcast today and help us realize our goal, which our goal is to educate and empower individuals to take charge of their own health. And you have definitely helped us realize that goal. So thank you so much, Greg.
It was awesome. Happy to be here, Shawn. Thank you.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune into our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time, Monday. I'm not sure who our guest is yet, but it's going to be a good one. So thank you all for tuning in. Health Solutions with Shawn and Janet Needham. Thank you.